heart failure is the syndrome that occurs from progressive inability of the blood to meet the body's oxygen and nutrient needs. Older term is CHF, congestive heart failure. However, maybe 5 or 6 years ago, they stopped using CHF because the whole congestive part, they are starting to find it doesn't really apply to the right side. It only applies to the left. So if you classify somebody with CHF and they're right-sided, it can throw people off. So causes, most common is going to be CAD, cardiomyopathy, hypertension, heart valve disorders. Our heart valve disorders, we already went over, those are like our mitral valve stenosis, our aortic valve deficiency. Oh, who's that? Who's it? Oh, it's Gary. Oh, Gary. I didn't remember her wearing a black jacket. And I was like, oh my God, Miss Kay is still here, and she's in the green. Like, we all have to follow our own.
Even if you pee yourself.
Yeah. Yeah.
Absolutely not.
And then myocardial infarction. So, for the pathophys of heart failure together. So we are going to look at each ventricle. We have to make sure that, so for our ventricles themselves, they are supposed to equally pump the same amount of blood flow for every pump that the heart does. When it comes to heart failure, it's more than either the ventricle or the heart can handle. So the heart, if you look at it like a pump, it can't keep up. The left ventricle typically is going to be the first one to weaken, and then failure of the left is going to lead to failure to the right. So here is left-sided. For your review, can you guys tell me what I
clinical manifestation?
Thank you. Also, for your review, I feel like we shouldn't, I shouldn't keep this as a secret, I suppose. So just was brought to my attention that I fucked up and deposited for you guys. So I'm your review sheets. Sometimes it really does work in people's favor when I become very aloof. All right. Under interpreting of cardiac EKG strip, and then it says strips on test. Last test, you guys had that multiple choice question, like use alcohol packaging, stuff the electrodes. That question was also on this test.
Okay.
But you already filled it.
I have everybody's attention.
Yeah.
Yeah.
So where it says, again, my aloof behavior is going to work here in here. So ECG, inspect pads, use alcohol wipes to wipe the skin prior to placing, no talking, uncrossed legs. That's the answer.
I figured that.
Yeah. The next question, know the 6 steps? That is not the answer. Just FYI. So that is something we are going to have to review next week. But I did double check. And if you guys go to the back page where it says heart disease and then 3 bullets down it says hypertension, heart disease, that's also going to be a multiple choice, and those are your answers. So it's multiple choice, 3 out of 5, and those are your answers.
Okay.
Back page, last page, I think it's under heart disease.
Yes,
3 down,
hypertension,
hypertension, heart disease. So watch them, make a correct choice, show them strategies, and discuss the physiology. Those are your 3 answers. You're going to select all their site, and those three answers out. No, but you are gonna get, so for your peripheral circulations, page 1, third topic down, identify the pulses. You guys are gonna get a hot spot question where it's gonna show you a picture of like a whole body.
Okay.
It's gonna ask you with the hot spot to locate the brachial artery. And then on the body, you just have to put the square on the brachial, and then, or a circle, and then it'll highlight the area that you're trying, if that is the area that you're not looking for, you can still change it until you hit next. All right, it's like a magic thing. Okay.
And you have to do it for all of them, right?
No, it's only gonna be one, but I want you guys to
To
know
where all of them are.
all your
Gotcha.
pulses, yeah. It's only gonna be one.
So it's only gonna be for,
No,
or we gonna choose, you're gonna, so the answer is gonna be whatever you
yeah.
put in, okay, but we need to know the pulses. Okay.
Yeah, and I feel like last class I asked you guys
Well, I know this.
where the pulse,
I know the pulses. Yeah.
where one of them was, and all of you guys were like, inside and out.
Yeah.
You guys remember that part?
Yeah.
Try it.
Inside the eagles.
Okay, back to
Business.
Back to heart failure. Okay, so left-sided. Right. Okay, moving on. So, left-sided heart failure. So the whole premise behind left-sided heart failure is going to be the afterload. So the force generated by the left ventricle to eject the blood into the aorta through the aortic valve. So this is why the left ventricle is going to crack out on its first. You guys get that?
Yeah.
Okay. Peripheral vascular resistance. This is the pressure that we have in the aorta and also the arteries. That is what pretty much triggers our afterload. Then hypertension is a major cause. The blood backs up from the left ventricle into the lungs is a cause, and then the alveolar edema is going to result. Left-sided heart failure, so this is just them kind of showing what's going on. I think it's a terrible slide. All right, right. So right-sided heart failure, the major cause is left-sided heart failure. Again, if the left goes, the right is going to go next. Must continually pump blood against the increased fluid in the pulmonary artery and lungs. So when you guys hear right-sided heart failure, I want you guys to think all things pulmonary. Okay. Let's see. So the cor pulmonale, that's going to be the right ventricle. It hypertrophies and fails due to the increased pulmonary pressure. Again, pulmonary. Backward buildup of blood in suspended blood vessels, and then peripheral edema results. Right-sided heart failure is 100% peripheral edema. Swelling pretty much on the lower legs. And when I say swollen, I mean like +3 pitting. These are going to be your patients that are always going to be on Lasix, Neurosis. They are going to be coming in, and we are going to want to get so much fluid off of them so fast that they're going to be getting, their dose is going to be 80 milligrams of Lasix. A normal dose is 20. So they're going to get admitted, and we are going to pretty much strip every ounce of water that they have, and then the relief that they're going to feel off their chest is going to be like night and day. And it can all happen within 12 hours.
Thank you.
All right. This is everything that right side is gonna affect, mainly this area.
I can't. So don't.
All right, so we, I don't think I remember a slide like this, but, all right. Designed to meet cardiac output also contributes to the cycle of heart failure. All right, so maintain cardiac output when it's low. So the sympathetic, you guys still have that slide of the sympathetic and parasympathetic, or the handout.
Yes.
Nervous system raises the heart rate, which then is going to increase the cardiac oxygen needs. So if you think of somebody who is running, just say, their heart rate is starting to increase, as is their oxygen need. All right, our RAS is then going to be the anti-diuretic hormone, save water, which then is going to increase the fluid volume. The chambers are going to dilate, the muscles are going to hypertrophy, which then is going to increase cardiac oxygen needs. All right, so acute heart failure, pulmonary edema, severe fluid congestion in the alveoli, life-threatening, and you are pretty much drowning in your own secretions. So, pink frothy sputum. This is the #1 sign of pulmonary edema. Again, this is like, and this person is literally, their body is drowning from the inside out. If you have a patient that has this pink frothy sputum, the #1 thing you have got to do is call the healthcare provider. It is going to be an emergency that if it's not treated right away, it's going to be a cold. So, rapid respirations with the use of your accessory muscles. There's going to be severe dyspnea or tachypnea, crackles, wheezing, anxiety, restlessness, cold, chills. So in order to diagnose, they're going to get EEGs, they're going to get pulmonary pressures, they're going to do a chest x-ray. Here are some interventions and some nursing diagnoses. So chronic heart failure is progressive. There's no cure. And signs and symptoms may get worse over time. So signs and symptoms of chronic heart failure is fatigue and weakness, DOE, orthopnea, nocturnal dyspnea, cough, crackle, and wheezing, tachycardia, chest pain. Oh, God. Change strokes, respiration, edema, anemia, nocturia, cyanosis, altered mental status, and malnutrition. I feel like everything on that list is either caused from the inability to breathe correctly or from some kind of fluid buildup, like the cough, the crackles, the chest pain, the change strokes. Like, I feel like this is all knowing the difference between left and right. Like, I kind of feel like this all makes sense. So complications, you're going to have a liver and spleen enlargement, pleural effusion, thrombosis, and emboli, and eventually it can lead to cardiogenic shock. These are some of our diagnostic tests. Some of our intervention goals. And some medication therapy. Some interventions. one of those interventions, which is called the intra-aortic balloon pump. And then, all they're saying here is that these ventricular assisted devices in the heart transplant, it's going to support the failing heart, bridge to the transplant, do like a destination therapy, and then you're going to end up with a heart replacement. This is what they call an LVAD. I don't know if anybody's ever heard of the vest called an LVAD. So this is the left ventricular assist device. So everything about this device is run on a battery pack, and it is pumping the blood for the patient. Here's some surgical interventions. Nursing diagnoses. Interventions. Okay, let's see what I have. All right, so if you have a patient who is saying that they have dyspnea and fatigue, and then upon your assessment of the patient, you notice that they're tachycardic, and that they have some edema, are you guys gonna think that it's heart failure, or are you guys gonna think that it's like a valve issue, like aortic stenosis or mitral valve prolapse? Like, what would you guys think? They're tachycardic, they have edema, they are fatigued, and they're complaining of dyspnea.
I would say heart failure.
And I would probably write those four things down.
Fatigue, dyspnea, tachycardia. If, you're welcome. Edema.
So let's say, we're gonna talk about left side of heart failure. And let's say the nurse is about to give a dose of digoxin. If the nurse is gonna give the dose of digoxin to a left side heart failure patient, what do you think the nurse should see on that patient? So we already said dyspnea, right? Yes. Yes. Okay. What else did we say?
Fatigue.
Oh, no, I thought you said something I missed, sorry.
No, no,
Okay.
those four things that you guys just wrote down, what was it?
Edema.
Dyspnea, edema, fatigue, tachycardia.
All right, and orthopenia is gonna be left sided. I want you guys to know that, like gastrointestinal bloating is right-sided. GD would be right-sided. GD, jugular vein distension. I know, it's hard to hear anything over Corinne. She's really taking the spotlight over here.
Don't mind me.
Yeah, don't worry, we're trying
Don't
to.
mind me. I'm just trying not to die.
Keep drinking water.
I actually ran out,
You
so,
wanna go get a refill?
sure.
You're not allowed to.
Gabby, do you want me to die?
No. You want me to try?
Jesus.
It's like that, it's not me.
So we said peripheral edema, right?
Yeah.
We said JVD, anorexia. And anorexia not in the case of somebody who chooses not to eat. This is an anorexia where the patient has no appetite. And that's why they don't eat. And nausea, they're also big. So there's that. Let's see. If I go with you guys. If I told you guys that your patient had a heart murmur, would you think that that is left or right sided heart failure? What's that?
That's left sided.
The heart murmur?
I will think more right-sided.
What if it's neither?
Oh, then it's neither. No, because the heart murmur, sometimes it's an indication of the valves not closing properly.
So that is actually the answer, guys. Let's develop this one. Thank you. Thank you kindly. If somebody said, it's quiet right now. Chest pain. Would you guys immediately go to heart failure, or would you guys think something else first? Heart failure.
I would think
I would think
so.
something else first.
What would you think of first?
Just,
I would think this is a big one.
I would think like heartburn maybe, because I know
Okay.
I have, sometimes I have chest
Mhm.
pain from heartburn.
100%.
Sometimes even hypertension too.
Uh-huh.
Yes.
That's another thing, gas, Aisha.
Right, and what do you think about it sometimes?
I thought that line.
Yes. Yes. So if somebody's gonna give you answers like, hey, we're collecting all this data, blah, 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 what do you guys think is gonna be for heart failure? I want you guys to think like our initial approach, right? Like if somebody said to me like chest pain, I wouldn't think heart failure.
I would think heart attack first.
Yeah,
that's what
I
I
feel
thought.
like they're gonna come to the ER for a heart attack.
Mhm.
Heart murmur, I'm thinking there's something else going on in the heart, whether it's valve or something artery related, but I don't think it's gonna be the failure of one side. But then if they're like, hey, crackles in the lungs, right? I'm gonna be like, ooh, that could be a heart failure,
Yeah.
right? But if they were so specific to say peripheral edema, that to me is gonna be more relevant in heart failure
Yeah.
than the crackles, because the crackles in the lungs could also be a respiratory condition,
Yeah.
right? So like if someone was like, hey, crackles in the lungs, I'm thinking, oh man, what are we dealing with here respiratory wise? That's like my knee jerk. But if somebody told me they had peripheral edema, I'm like, God, damn, we're talking right side heart failure. So if you guys see a question and there's all these different types of ailments, and it's asking you to choose like what side is what, I want you guys to think and just be like, what is, if somebody said X, Y, Z, God bless you, what does it initially make you think? Don't just think because it's a cardiac test, I'm only asking you guys to think cardiac, right? All right.
What are the clinical and what would somebody with heart failure?
Well, why would they be furosemide? And when would
To reduce the sodium and water retention.
I think you have a question.
Okay, what heart failure need furosemide, and when would they need? Why do they need it?
That's basics, right?
Blood pressure is too high,
To remove the,
or the fraction is too low. Blood pressure is too high, and
I'm gonna take this in one question or two.
at least that's my,
Okay, why would somebody with heart failure be on furosemide? Furosemide is Lasix, right?
Yes.
So we're trying to get all the blood. And when would we hold it?
If the potassium is too low, hypocalcemia.
Yes. Exactly. So potassium is gonna be your trigger, your answer there. So, let's say, because we know that that promotes the excretion of potassium. And potassium, what is that, 3.5 to 5?
yeah.
Is that what you're still, okay.
Yep.
So if you have anything under testing purposes, if you really have anything like under 3.3, that's gonna be low. Really, you're gonna see, hypokalemia is gonna be the big answer, especially on NCLEX, for any type of diuretic, because if you have a patient that's on a diuretic that then ends up with hypokalemia, then you have to worry about that patient getting like heart rate or like dysrhythmias. And then with that is the possibility of death, right? And NCLEX is always looking to see just how safe you are with your patients. So that we have to filter in. Ma'am, you missed a lot.
Did you fill me in?
Okay, we got it.
You sure?
I'm positive.
Okay. No, not that. I believe she would fill you in, but we could as well.
Oh.
I knew she would fill you in. Think throughout these sputum, what's the number one thing you're gonna do? Also, remember we were talking about the side, the heart failure side that increases the spleen and liver?
Mm-hmm.
Right, you're right.
Hepatomegaly? Hepatomegaly, I think it is.
Yes.
HEP. HEP, I feel like I'm about to bust out EBC's over here. HEP, hepatomegaly. So that's gonna be the enlargement of your liver and spleen. And that is going to also be, like a finding that you have heart failure.
You spell it.
I'm gonna try. HEPATOMEGLY. HEPA, HEPA, megaly. I feel like we're gonna say mental. Sharknado. Okay, so Cinnabro we talked about, right? Nitro we talked about, peripheral circulation, we talked about, identify pulses, it's gonna be one pulse, and you guys just have to identify it. Left side we did, right side we did, pulmonary edema we did, arrhythmias we will do. Interpreting with the EKG script, you guys know the first one is a freebie. Heart disease, you guys know, that is a question you guys have already had on the other question call. Your conduction system. Alright. We did arteriosclerosis, PAD. You guys are getting quiet. The modifiable risk factors. As soon as we start talking about chapter 24, I had asked you guys like, oh, you know why? Because some of you guys got the question wrong on the first test. Is high cholesterol modifiable?
Yes.
Yes.
Is hypertension?
Yes.
Is obesity?
Yes.
Is smoking?
Yes.
Multiple choice, 4 to 5.
You mean select all the time?
Select all out of 5. Out of 5, how many did you guys just name? 4.
Or
I think you guys are gonna nail it. That's your modifiable risk factors. And for the PAD, we were talking about our cholesterol levels. We talked about our total cholesterol, our active cholesterol, HDL, and our LDL, which is our loser cholesterol. Remember? Somebody was talking about cholesterol levels of here. And we were saying that, we said that, I believe the normal was 130.
for the
LDL?
The LDL.
Thank you. Yes, correct. So our triglycerides and our LDL both have to be under 130. So we did that, we did that. You guys now have the answer to hypertension and heart disease. Say again?
For the one that says PAD, which lab places patient at high risk, is up to high LDL? That's the answer. On the sheet right here, high LDL.
LDL.
Okay. Which lab?
Yeah, which one is
Do
LDL?
you guys know do you guys know how Nitro works?
Yes.
Yeah, it's for her, check
Yes, but I want you guys to know that the mechanism of Nitro is that it dilates your blood vessels and it allows you.
Okay.
Yes. Yes.
Allow more blood.
So if somebody's coming in and they're having an MI or chest pain, do they sometimes have nausea?
Yes.
Do they sometimes, are they sometimes tachycardic? And what about diaphragm?
Yes.
Okay. Do they have a headache?
How do you feel hypertension right now?
Yeah.
Okay.
Yeah, so they're gonna come in with a headache if they're in hypertension crisis.
Oh,
okay.
Yep. Hypertension crisis. And let's see, this question, all right, orthopenia, are they gonna come in with orthopenia?
Yes.
Not yet. So,
Okay, oh,
and I
that's
knew I
the
was
most
gonna get
severe.
you guys, yeah, and I knew it was gonna
Okay.
get you, which is why I'm not. So orthopenia isn't going to be a symptom that we're gonna see for somebody who comes in with an MI. And an MI is gonna lead to heart failure, which is when you're gonna see it.
The orthopedic, okay.
But they're not initially gonna come in with it just for the MI. So if you guys had 5, select all but 5, give me 3 of them.
No, it's just weddings, tachycardia.
Right, is not what we said.
Well,
Thank you.
My bad.
Um,
It's right here. Got it?
oh no, is that it?
Oh.
What did your sheet say?
Venous insufficiency, cardiac rehab.
No, I have all that, but like, what do you guys have filled in?
For what? The next one after that.
Dee, what you got filled in?
Hold on, let me see the paper. I got venous insufficiency.
You do have that?
Yes. Signs and symptoms. Swelling in the legs and
We did over in class or something at home.
I think we were going through the PowerPoint, I didn't, but we never stopped, but I just. Sorry.
I need to see that.
Varicose veins, leather skin and brain edema. We talked about that.
Dee, you gonna read out what you said about her?
Oh, it has dropped.
Okay, so I can say something.
You need cardiac rehab.
So for cardiac rehab, can we undo the damage
You
Under the
said,
local law.
no,
while they're in cardiac rehab?
no,
No.
No,
wait, what?
no, you can't undo the damage while they're in cardiac rehab. The damage is done.
Oh, yeah, yeah.
If you guys have a
And we should
patient
back to the
who's
previous
bradycardic,
activity.
what do you guys think, like, one of the complaints is going to be the bradycardic?
Dizziness,
Or,
fatigue,
or,
fainting,
what causes fainting?
lightheadedness.
Thank you. Venous insufficiency. Findings.
And signs and symptoms.
You are correct.
What you said, yeah?
Sitting edema.
Okay.
Yes, and
And yeah, brown, gross.
It's like brown
Symptom, yes. Nitro, yes. Protocol circulation, yes. Left, right. Pulmonary edema. Heart rate is, oh, signs and symptoms of bradycardia. That's what it is. Yes. All right. A is which medication will decrease the heart rate and the rate of the AV conduction?
the doctor,
Good job.
okay.
Why is warfarin given patients with new onset atrial fluid? Yeah, I think,
Preventing stroke?
say again?
Is it preventing stroke?
Yes, and that's what I was just going to say. I think you guys are gonna see on the test that it's gonna say it helps to prevent strokes, which you guys also know, that the warfarin is just preventing, that thrombus to form.
Yeah. It won't destroy what
The EKG, you know, the first one is a kidney, we'll do that one, we'll do that one. Do you guys, if you guys go down 1, 2, 3, 4, 5 bullets, do you guys, if your EKG has no P wave, what arrhythmia does it have? I'm so proud of you, Ro. Yes.
I remember.
Yes. So if there's no P wave, you are looking at somebody that has a fib. Yes. And then that, and then that, and what else? I think that'll probably be it, or because then the rest we can go when we do EKG. Okay. And just FYI, if you guys are prepared on EKGs and reviewed your chapter, everybody's staying. Everybody's staying. Nobody's going home on the next one. Even if we are prepared? Even if you're prepared, okay.
Yeah, you sure?
Even if you're
Even if I
prepared.
was prepared, I was probably.
Even if I was prepared.
Right, everybody's staying. I'm gonna hit the light.
I can feel
It really does make a difference when you say that.
What happened?
It really does make a difference.
Like to tell you guys I'm hitting the light? Yeah, because I feel like it's a little shock, like when it just,
It is.
it's like you're sleeping, like the light.
She said you're sleeping so
Heart transplant. Another case study.
Yes, and we're gonna come on,
No.
unless you go home, they're gonna say, I give it to you today.
So, Britt, before you think thinking, I quit because it's too much. I had to because yeah.
That I know something's missing. Wait a minute.
it's too light.
Oh, I
Well, 41, and then look at some cases up to 30.
Because it's like, I guess you're supposed to walk around with that in clinical, look at the front. No. I guess that's the purpose of the book. See what it's in the front?
No, not her.
The clinical handbook.
I saw it at Sabres and said, well, thank you. Add it to my collection.
Yeah.
And she already has access blood. Pack it up.
Oh!
No, I'm not. But you know what she was trying to do?
get an extra. So
She
they
was
can.
trying to have them tell her what to study.
Oh!
So she got extra time and did what with it?
But she's gonna change the case.
She did.
She always changes the case.
I know.
She's not like nobody else. Every other.
But even Miss Nova Scotia changed the test too, because remember, how,
I got like, what, 15? Or 16.
You kidding, right? How many?
Yeah.
But I got the same grade in.
Really good. She probably.
This is good.
She was max, like, half of my, more than half of my
Because it's like always pictures.
Yeah.
Because you get a lot of passion.
Girl.
Oh my God.
How you doing? How do you do everything that we did the first time? Like, that'll make sense.
Everything.
I wonder if it's just that.
Yeah, I gotta quit the job so I can find the time to read the books. Because
That's great.
you wanna make some copies for the class?
That's up to you. No.
Oh no, I can't make copies.
You don't. That's why I said she's so smart. She's so like. Really just like give.
Huh?
Yeah.
Well, Roman did.
I know.
I mean, I feel like this class would if, you know.
Guys, what I do with my pen?
I don't know, this is not over here where you said.